Awful lot of Tory backbenchers, funnily, seem to have found their backbone in the last few days and decided they might stand up to the government on something. And this over the manifesto pledge, which was very clearly written out as one of the key manifesto pledges for the government, which was not to increase income tax, national insurance or VAT. Now the government is planning to increase national insurance to pay for social care. First of all, is that the right thing to do? And second of all, if it's not, what should the government do?
Well, we ought to start, Julia, with what they're going to do with it. I mean, they don't actually seem to have a plan. This is either for social care or for the backlog on National Health Service. They've altered between the two in the last week. So that's the first thing. What's it for? Second thing is, are you talking about hypothecating the whole national insurance contribution? In which case, there might be an argument. Otherwise, it's the worst possible tax to increase. It hits, as people have said, low paid people, shop workers, the young, but also it destroys jobs. So it's the wrong way to do it. If you're going to break a pledge, and my hunch, I'll be blunt with you, is the government is going to break one of its tax pledges in the coming few months to pay for social care. Yeah. This is probably to do.
I mean, and this is the thing, isn't it? National insurance, it is a tax. It's just a different kind of tax. It's not optional. It doesn't go into your own personal little pot to pay for your care in the future or your pension. Rubbish. It goes straight into the normal, tax coffers. But the crucial difference between income tax and national insurance is the lowest paid still pay national insurance long before they're due to pay any income tax on those lower rate thresholds. The over 65s, no matter how much they earn, they don't pay it. If you're earning it on your investments and on the like, you don't pay a penny of it. And the highest paid the lowest rate of national insurance on all grounds. This is the one tax that you shouldn't be raising because it's the one that is not as I think most people regard it as fair in the sense of being progressive as other taxes. Why does the Prime Minister think that raising national insurance is going to go down better than raising income tax? Is it because of what Gordon Brown and Tony Blair did in the early 2000s where they did say they were going to do it, they put it in the manifesto and then they raised national insurance and it was actually a very popular move?
Well, it's partly, I think, because of a 100-year-old con trick. And that is that people are led to believe that national insurance is what it sounds like. It's us paying for something for ourselves, and it's very heavily associated with the health service. Actually, it's as you say, it's just another tax. I think it's about the cosmetics rather than the reality. And that's really dangerous. I mean, at the moment, in the coming year or two, we're going to have to fight our way out of the coronavirus depression. And to do that, if we increase taxes, we're going to have to do it in a way which doesn't cut growth, doesn't cut employment, doesn't cut people's incomes by very much. And this does all those things wrongly. So I think the primary reason is cosmetics, because people think of national insurance as something associated with healthcare. It's not. It's another way of the Treasury collecting money.
And this is the concern we're told by the Chancellor, Sajid Javid, who, let's face it, is too popular and too powerful to be sacked by the Prime Minister, but they've been at loggerheads for a very long time over lockdown policy, furlough and the like. But he has basically said that he wants, he doesn't want this tax rise to go up, and he wants to also, if it does, they're disagreeing over whether it's 1% or 2%, whether it's partly it's employers or just employees that goes up. But he wants it to be very specifically to go on social care and not just subsumed into the massive NHS budget, as the first few years would be, though. Realistically, it would raise up to 10 billion. And in the first few years, that would more likely to be used to deal with backlogs in treatments at the NHS for the last 18 months than social care. And one of the concerns is, it's not going to go into social care. It's always been the Cinderella sister of our health and social care system. And once again, it will be going probably towards paying NHS consultants a bit more.
Well, you say it will go into the backlog. I mean, at the moment, I see no plan for reducing the backlog. I've heard not a word about how they're going to do it. Secondly, remember what you mentioned the Tony Blair, Gordon Brown increase all those years ago. Do you remember what happened as a result of that? We had a 25% increase in GPs' pay. Yeah. It didn't give us one extra day of healthcare. It just used money, and that's your danger with this. If the Treasury are willing to say the whole national insurance budget goes to healthcare and is guaranteed, what they call hypothecated, but guaranteed by law to go there, I might be willing to listen, but they're not. They're just treating it as another.
I mean, there are two sort of debates going on. One, how to pay for this if it's funded through tax. The other is, and we were talking to Marcus Fish, one of your Conservative colleagues on the backbenches earlier, is whether or not the government should do this at all, whether this should be through taxpayers paying for it at all. Do you believe there is a crisis in social care that can only be resolved somehow by the state stepping in, or do you think that fundamentally there is no issue with rich people who in the southeast of England, you've got an expensive house that they bought for a tuppence and is now worth £1 million, having to sell their houses to pay for their social care? Where are you on all of that?
Well, I do think the state should do something about it. I think that the approach they're taking is wrong, this idea of a cap. I'll come back to it in a second. But yes, because a lot of people, more and more people in this day and age, as they go into retirement, are terrified of losing all their savings, of going into a home with dementia and whatever, and basically losing everything they've worked their life for. And and that's more true in the north than the south in many ways. 80,000, which is the cap they've been talking about, in Hartlepool will buy you a terraced house. Down here it won't be, maybe make a contribution to your swimming pool in Henley or wherever it is. So I think it's the wrong way. We ought to have a state insurance scheme for it, and right enough, people should pay into that. I mean, actually, funnily enough, I'm not a great fan of Andrew Lansley, but one of the things he proposed way back in 2010 and earlier was that when we retire, many of us, if we get private pensions, get a large cash payment at that point. Why not put £10,000 of that into paying for an insurance scheme? That sort of approach will be much, much smarter than the ridiculous cobbled together idea that they've come up with now.
Let me also ask you about the other big issues. We could keep you on air till about 10 o'clock, frankly. There's so much to ask you about. But you've been someone, you campaigned against ID cards. It's something that's been a very big issue for you. We are going to be seeing vaccine passports, which go even further than ID cards. It's not just identifying who you are. It's actually giving away your personal private medical records. They're going to be, we're told, guaranteed that is going to happen at the end of September. It wasn't just a threat, but despite the fact the government's repeatedly said that wasn't going to be the plan. We're also going to see a vote later this month to extend the government's emergency powers. Again, we're 18, 19 months in to this emergency. At what point does it stop being an emergency? Where do you stand on both of those key issues?
Well, I was the first person to raise the red flag, as it were, on the emergency powers right back at the beginning, and I still take the same view that they no longer need extension. In fact, just the opposite. We ought to have a freedom bill to revoke every law passed under the Emergency Powers Act, because most of them people don't know about. They're just ministers that did it, Yep. So that on that side, I'll be opposing the extension. And this time, by the way, if the Labour government, it's not Labour government, the Labour opposition
it may as well be a Labour government.
I know, don't get me down that road. But if Labour got some nerve about it, they would realise that this is now the popular move to take, to stand up against the government on extending these unnecessary powers. On the so-called coronavirus passport, it is an idea looking for a problem. It's not actually going to do any good. If you have been vaccinated, it protects you. It doesn't particularly well protect other people. It stops you getting a very serious illness, but it doesn't stop you becoming infected, and it doesn't stop you infecting other people. So we're now going to have a certificate saying we've got a vaccine protecting ourselves, and we're pretending it's protecting everybody else. It's misleading. Apart from all the civil liberties issues, it's also dangerously misleading. And again, I hope the opposition parties grow some courage over this, because I think there's a growing opposition on the Tory benches too. It certainly will include me.
David Davis, really appreciate you joining us. Conservative MP, former Brexit Secretary.